So what are we going to do about it? This is going to be a little bit of a shift. As the director of agriculture in a nutrition organization, we have to look beyond productivity and the optimizing productivity for nutrient-dense foods, where that's essential. It's not sufficient when it comes to the nutritional status of babies. Those foods are a long way from the baby's mouth, so it's pretty critical that we begin then to place what is the paradigm for nutrition, which is a life cycle approach, on these supply chains. And when you do so, one of the big questions that you come up with are, where are mothers sourcing their foods? I think there's a common understanding, or at least a belief, that they're sourcing them from on-farm. And therefore, one should be able to improve the production system, and then the children would have a better diet. But we, again, with the support from the USAID Feed the Future initiative, and with a team of focused ethnographers from Cornell University, as well as Noguchi Medical Research Institute in Ghana, and with the University of Nairobi, have conducted a series of focused ethnographic surveys, including the use of a tool that was developed. It's a linear programming model to understand the adequacy of the diets. So we've gone into some very particular farming communities in Kenya, now in Ghana, and starting in Tanzania, to take a look at the constraints to better feeding practices for mothers and the adequacy of that diet that she's providing for her children. So this is sort of hot off the press data, and I'm sorry, so don't ask too many questions about it, basically. But what I'd like to do is share with you what's recently come out of some studies we're doing on communities in the ASL regions of Kenya. And in particular, the focused ethnographic survey work that's coming out of Turkana, Isiolo, and Marsabit. It just came in yesterday, so I'll try to, what I'd like to do is put up only a single photo. You don't have an entire presentation. But this is Mercy Ikuru. She's 30, and she's a mother of 4. She now lives in Isiolo, but she's a settled Turkana woman. She's been there for 2 years. Her diet, so we looked at her diet and then her children's diet. So her diet is extremely seasonal, and she gets that food from the market, but she also receives a lot of food aid. And her diet has changed quite substantially since settling, but so has access to foods. She relies mostly on income from making beads and making charcoal, and that is what is feeding her family, this income, because she doesn't have access necessarily to the foods that she had when she was a pastoralist. So with the exception of milk, she does still keep goats, so she does still have milk in her diet. Now her infants, what we're finding is the food that she's acquiring for her infants, 100% of the core staples, it's coming from markets. She, with the exception of the occasional milk that she gets from her own goats, everything else is coming from the market. And I think we need to recognize where food is coming from for infants and see what is the resilience of markets. What's the diversity in the market? And how do we try to bring a more diverse diet or an adequate diet for infants in the case of fortified complementary foods, or even in better diversity into the markets themselves. So let me just pull, okay, so what is her food? So she has her own animal milk, and you know what? There's a lot of tea. Tea, sugar, a bit of animal milk, porridge, which is entirely purchased, which is a maize meal, as well as what they're calling baby porridge, baby flours, which has a bit of millet in it. Ugali is entirely purchased. Rice, entirely purchased. Potatoes, entirely purchased. And then banana, seasonally, entirely purchased. She feeds her child 1 to 2 meals a day. All of the children in these studies were breastfed, and exclusively up to 6 months of age, and then still breastfed through 23 months. However, so the message here is that, of course, markets need to be better. The other message that we're finding is that nutrition messaging is getting into these communities. They're getting into these communities. But when she goes to the market, there's nothing there. So you suffer this incredible burden as a mother to say, you know what, I know how to feed my child, but I just can't find the food. So we have to think about that big constraint that she has. So the message I have is that we need to ask where these foods are coming from. We need to have a better understanding of the demand side of these foods and how we're going to get them to these very particular populations where we can actually move the needle for nutrition. So it's not enough, it's essential that we diversify productivity, but we need to diversify the diets. For gain, I'm judged on whether I can produce an affordable, diversified diets for communities. That's my KPI. And the way that we have to do this is really understand what are these constraints for these moms. So the resilience of the food supply system is where I would hang a big flag for women of reproductive age and children under 2, and then for the population at large. Thank you.